Hey guys, it's Gianna, MidwiFay. Today I wanted to talk about sure signs that you're in labor, okay? No more guesswork. How do I know when I'm in labor? When is this gonna be the real deal? I just wanna meet my baby. Someone please tell me. I'm gonna share with you my 3 tricks to know that you're in really active labor. Let's take a listen. Let me say as a disclaimer at the beginning of this video, the way I did at the beginning of my water broke video, is this is only referring to low risk pregnancies, okay? So if you are full term, over 37 weeks, if you have one baby in there, not 2 or 3, no multiples here. If you know your baby is head down, okay, usually that's established in the last couple of prenatal visits. And as long as you know you don't have any major OB complications or placental abnormalities, okay, so I'm talking about low risk pregnancies, one baby, head down position. That's what I'm referring to when I'm going through all of these sure signs of labor and when to go into the hospital. My first tip, number 1, is regular contractions, okay? This means strong regular contractions that are happening and you can put a clock to them. Usually you're using your contraction timer on your pregnancy app or a separate timer. You're timing from the start of one contraction to the start of the next contraction. When we do this, we generally tell you to use the 4-1-1 rule. Okay, you're having contractions every 4 minutes that last at least 1 minute, and that's been going on for at least 1 hour. That 4-1-1 rule is usually what we use to encourage you to call your doctor at that point and or to go into the hospital. Now, sometimes the contraction apps will tell you you should go to the hospital now based on what you're charting. So some of them are synced up with that 4-1-1 rule, others aren't. What I say about regular contractions is that, again, in early labor with irregular contractions, or even if they start getting regular but they're not intense, you know, if you can pull your phone out and be like, oh, okay, let's start one, and you kind of breathe a little bit and you stop it, and then you drink some water, and then, oh, let's start one and stop it. When you are the one that's able to do the contraction timing, if you're super conscious of the contraction timing, that might still be a little early. You know, once you're transitioning to that really active labor phase, it takes so much energy for you to really focus and go inward and breathe to focus on your contractions, okay? So usually your partner is going to automatically be entering the contractions in the contraction timer at this point. Here she's gonna look at you and be like, yep, one starting now, because you are gonna be inward, okay? So using the 4-1-1 rule for regular contractions that are taking your breath away and that are causing all of your focus to be on the contractions, not on the timing of them, okay? Your second sure sign of active labor is vaginal bleeding. So when talking about vaginal bleeding in pregnancy, that's often a reason people seek care anyway, okay? Vaginal bleeding in any stage of pregnancy is not something that should just be shaped off as normal, okay? There can be light spotting, pinkish discharge, things like this that your provider might tell you to expect after an exam or something like that. But vaginal bleeding, especially in the context of regular contractions, is a sure sign of labor. So as labor progresses and baby's head comes down and applies pressure on this cervix here to open it, your cervix starts to bleed as it dilates. It looks like bloody mucousy stuff, okay? Not just like frank bright red blood streaming out. That's abnormal, for sure, go get checked out. But like the bloody mucus stuff that starts to happen, especially as you've been having those regular 4-1-1 contractions, or even maybe earlier than that. As the cervix starts to dilate, it bleeds. Usually we see bleeding and bloody shows start 3-4 centimeters or so for a first-time birthing person, somewhere along 5 or 6 centimeters for someone who's given birth before. So you can rest assured that if you're starting to see vaginal bleeding that's like a mucousy blood or like a menstrual-like period-like bleeding or more, that is a sign of labor with contractions, okay? And my third sure sign of labor is leaking fluid with contractions. Please watch my water broke video. I go into it more detail there, but I'm saying when you're having regular contractions that you've been able to time, that you know when the next one's gonna come, they're in that regular pattern, even if they're not yet taking all of your energy, they're not yet super uncomfortable. Once you notice a gush of fluid or you're starting to leak fluid out and your water broke, that is a sure sign that labor is going to intensify in most cases. So I'm going to say when your water breaks, obviously, with strong and regular contractions, mama, that is your sure sign that you're going into labor. Okay, let me know in the comments if labor was very different than this for any of you. I would be interested to hear what your labor experience was like. I hope this helps. Please pass it along, share it with another expecting mama. I will see you next time. Take care. Bye-bye.